Welcome back, everyone. Hopefully you enjoyed your break and are ready for our next session entitled Breaking Point, Workforce Crisis, and Fostering a Culture of Support with our speaker, Mike Mulqueeney. And as always, we're here for you. So ask questions, use the chat, and have fun learning together. Welcome, Mike.
Hello, everybody. My name is Mike Mulqueeney, and I'm with Johnson & Dugan. We're employee benefits consultants here in the Bay Area, where we've been doing business for about 38 years now. I'm happy to join you today with a panel of some very bright folks that have a keen eye on the emotional stress and everything that we've been going through the last year and a half. You know, a year ago, we were wrestling with the emotional effects of remote working, distance learning, and how to manage our home lives while keeping up with our work responsibilities. Now, as we're not so easily integrating back into various levels of working back on site and have an ongoing public discourse on the merits of vaccines, what we can all agree on is workplace and home life stresses are all at an all-time high. We rightfully now have a public focus on mental health and well-being. I'm pleased to be able to bring together three minds uniquely positioned to comment on the topic, where we are, and what we can do to mitigate burnout and stress. So first, I'd like to introduce the panel. First, I have Lynn Perkins, CEO and founder of Urban Sitter. Hi, Lynn. Welcome. Glad you could join us today. Why don't you tell us a little something about yourself and about Urban Sitter? And then if you'd like, then you can pass the baton on to Andrea, and Andrea on to Sean.
Thank you for having me today on this panel. I'm Lynn Perkins. I'm the co-founder and CEO of Urban Sitter. We help families and care providers connect anywhere from childcare to elder companion care, pet care, tutoring, you name it. And as you can imagine, just a little interesting fact, obviously, during COVID, childcare was heavily disrupted. We're now coming out of that, and we're still seeing a lot of uncertainty for families as they think about providing care as the situations are volatile and changing. So I'm excited to talk about that more today. And I will pass it over to Andrea to introduce herself.
Thank you, Lynn, and thank you, Mike. Happy to be here. My name is Andrea Notch Mayzeles. I'm a workforce health consultant with Kaiser Permanente in the Northern California region. I'm one of the subject matter experts for mental health. So as you can imagine, the last year and a half, my schedule has been packed with educating our customers on how Kaiser medical benefits work and best practices on how to build a psychologically healthy workplace, how to mitigate burnout, and really happy to be on this panel today to discuss this topic. Just a little bit about me. I've been with Kaiser for 7 years now. I started as a health educator. In the past 4 years, I was managing Kaiser's employee wellness program with Napa Solano physicians and medical staff. So really grateful to be in this new role, sharing the lessons learned on Kaiser's wellness journey with our customers. And again, happy to be here. So I'll hand it off to Sean.
Thank you, Andrea. Thank you, Mike and Lynn. It's an honor to be with everybody today. My name is Sean McBride. I helped start a company called Lyra Health, and we provide instant access to employees or their family members to high quality mental health care for everything from somebody struggling with stress to people that are dealing with more serious needs like depression or even suicidal ideation. We also partner with companies to really provide broader workforce mental health services to help companies build a culture that is inclusive and supportive of employee mental well-being. So excited for the discussion today. Thank you.
Great. Thanks, everybody. I'm glad to have you all here with me today. And well, let's just get started. You know, the state and care of wellness. You know, first I'd like to say one thing I've learned over the last year is the use of telemedicine and virtual medicine has really expanded and driven by the pandemic, obviously. But one area that's really expanding in this as well, it's not just telemedicine and office visits with doctors and things like that, but the mental health side as well has expanded quite a bit in the use of technology. So that's providing an easier access for mental health support. And it's not just with Kaiser, but it's really with all the carriers and the telehealth companies that we're seeing. Also too, you know, one thing that we found out is that, you know, Lyra Health has did a state of mental health report where they found out that, you know, 73% of employers responding to the current mental health needs with their employee population and look at increasing benefits here and utilization and access and those sorts of things. So we're seeing a lot of movement towards putting more attention on providing these sorts of benefits. And also Urban Sitter, found through its balancing childcare and work in the workforce COVID era, that 40% of parents were juggling, said that juggling childcare and work responsibility was a real challenge for them while working remotely. And while we are getting back to work, there are still a lot of folks that are still having to work remotely. So that really isn't going away either. And so we'll move forward now. And why don't we start with, burnout syndrome and pandemic fatigue. Andrea, what would you say that HR folks should know about this?
Yeah, thank you, Mike. I think we've all been hearing the headlines of burnout since the pandemic began. I think what we've realized is that it was prevalent before the pandemic, and it's only been exacerbated in addition to common mental health conditions like anxiety and depression. And as you can see here from the slide, we know that burnout is prevalent, that 75% of employees say they've experienced it. And we know that burnout is a little bit different than just stress, as you can see from the definition above, that it's chronic workplace stress. So we all might be feeling intermittent levels of stress, but burnout really is indicated by three common characteristics where folks are feeling energy depletion and exhaustion, increased mental distance from one's job, maybe some cynicism, and reduced professional efficacy, just feeling like, maybe they're not really contributing to the organizational goals or missions. The good news is that there's a lot that organizations can do to mitigate burnout. We'll be discussing that later. And I think just some other important, points to call out on this slide is just that, 51% of employees here are sharing that they are not receiving the emotional support they need at work. And so I think there's a lot of room for organizations to enhance the level of support. Often it's just a perception on behalf of employees, and there's a lot we can do to improve that. And as we'll discuss later, manager support is really critical in burnout mitigation and creating a culture of health. And we'll see here on the slide that there is room for improvement in helping managers really create that environment where their teams feel supported.
Great, good. Oh, one thing I would like to also add for everybody, if you have any questions, we are, responding to the chat box. And so ask your questions throughout and we'll respond to those in real time as we go through it. But yeah, please forward your questions as they come up. Andrea starts out with burnout, guilt, and anxiety, and this is a question for Sean, are you also hearing this? What suggestions do you have for companies to reduce this stress that employees who are also caregivers are also feeling?
Definitely have seen a serious uptick in employees and their family members reaching out to Lyra over the past nearly 2 years, and saw a specific spike about a month after lockdowns went into place. And it really kind of spanned the spectrum of mental health needs. There's just been a lot more focus on stress and burnout, but then there's also been a lot more anxiety, depression, suicidality. Over 10% of the people who reach out to Lyra share now that they're having thoughts of suicide or self-harm. We've also just seen our employer partners, I think, really lean into creating a culture of support for employees and thinking about a range of different benefits in terms of flexible work arrangements, how to support caregivers, and knowing that burden only got bigger with having children at home and not having care for children, as well as kind of the continued need to support people who are caring for elderly parents, et cetera. And also just a sense that we need to talk more about mental health in the workplace. So we've seen an explosion in companies that are really partnering with us to do a range of kind of live workshops and educational sessions, both manager trainings, but also directly for employees around how to promote a culture of employee mental health, how to facilitate conversations at mental health. And I think especially on the manager side, we've really done a bunch of specific trainings around how to recognize, notice, and respond to somebody struggling with a mental health need in a world where now a lot of your team might be virtual. And what are the adaptations that you need to make in a more kind of hybrid workplace to make sure that managers are spotting employees struggling and getting them the right help.
Great. Good, Sean. Thanks. Lynn, while workplace burnout and stress seem to be on the rise, many parents are still needing to work from home and have a continued level of stress. Home burnout is still here. The pandemic has created a new commodity called childcare. What would you like to say about this?
Yeah, no, I love that we went from burnout to childcare, because I think if you could survey parents, most of them would tell you they're not only just burned out by their jobs, but they're also burned out by parenting. And, as I mentioned before, I think a lot of people early in the pandemic realized how much was falling on the shoulders of working parents when they would see kids running through Zooms and people trying to put together pods of young kids because there were no days to be had at preschool or lower elementary school. So have it. But I think the thing to note now, we're at a different point in time. We're starting to see kids go back to school. We're starting to see daycares reopen. However, the one thing I would point out to employers, and we're hearing this a lot from the employers we work with, that their employees still have a lot of uncertainty around their childcare situations. It may be that the daycare they were in is no longer the right fit with the sort of flexible work from home schedule, or they may be in school systems where they're starting to have, we're a few weeks into school and we've had some COVID exposures, and there's still sort of policies are in flux in terms of what schools are doing when a case is identified. And I think to further, I'll talk more about caregiving in general, but to further on the childcare front, I think one of the challenges that parents are really feeling, and I know we all talked about it as a group, is that we know people who have had their kids sent home from school. And, last year, yes, it was a little crazy with teaching being online, but this year, in many cases, there is no online option when a class gets shut down. And so, whereas in the past you had some content for your kids, you're now scrambling to figure out what to do to keep your child occupied as you try to fulfill your work duties simultaneously. So I guess, unfortunately, while the COVID distancing may be lightening up in most places, unfortunately, the sort of the unpredictability of the childcare situation still exists.
Wow. Yeah. So Lynn, working.
Yeah, I'm happy. I mean, I'd like to expand it broader. I think, we've seen a lot of kids running through Zooms. We don't see as many elder family members, but they're there. And so our kids with special needs and other circumstances. And I think this is this survey was done by a group of both researchers and big companies that are focused on the care economy. And it looks at what employees are recognizing is impacting their well-being. Before I get into some of the stats, I think it's just really important to note that when employees have been surveyed, there was a big survey done, and 70% of employees in the US recognize themselves as being a care provider. So they are in charge of managing or providing the care for whether it's a child or an elder family member or a neighbor, you name it, but they have caregiving responsibilities that fall on them on a day-to-day basis. And so as you look at these areas that are really impacting employees' well-being, it's no surprise that increased caregiving demands is high on the list. We think of it in kids in terms of sort of the lack of structure around the school schedule. But if you think about it in terms of an elder family member, they may have new restrictions at the place they live. It might be a lot harder to get support in the home due to restrictions or concerns. And so I think it's important to recognize that when we think about your stressed out employee who has caregiving needs, to think beyond just the child front and think about people who have other responsibilities to family members. And this is not going to surprise most people, but this responsibility falls disproportionately on women. And it falls even more heavily on women the younger the age of the child in the child care space. And it falls heavily on women in terms of the elder care and supporting family members that way. And I think what ties into this, which Andrea and Sean have mentioned and we'll get more into, is that it also did not surprise me to see that decreased social connections coupled with the increase in work hours are really impacting employees' well-being. And in some cases, those may not be absolute increases in work hours, but it may be a situation where people are starting their day earlier to accommodate their caregiving needs and ending their day later. And so it's no surprise to me that these people who are feeling strapped at both ends, both in terms of their work output as well as taking care of their family members, are clearly feeling isolated. And they're also feeling completely stressed. So again, no surprise to anybody on this call, but I think the thing to note is that we're seeing this feeling of lack of well-being continue, even as we start to see situations change as we come to understand COVID, and we're starting to see a few restrictions start to ease.
Got it. Good. Sean, do you have anything that you would add to that?
I don't think anything specific, other than I think it's just another example of the wide range of things that have led to emotional and mental distress for people. We kind of think about just the anxiety or the grief that people might be feeling from the direct impacts of the pandemic. But I think burnout around caregiving and how that's actually been exacerbated by COVID and how that has a mental health impact is another perfect example of just a serious change in your life and your routine and your responsibilities. Goes far beyond kind of that specific issue and really can affect people's overall mental health and well-being.
Okay. And Andrea, do we covered it all, or do you have anything in there we missed?
Yeah, I think you've covered it all. I think I'm sure the audience is really rearing to go for us to get to solutions. I think we've all been really immersed in this data, related to more work hours. We're seeing this great resignation. There is evidence that shows that offering that flexibility many employees have been demanding these days does correlate to decreased rates of burnout and lower turnover, greater productivity. So really, kudos to all the companies who are able to manage that transition. I know it's been a lot of work, creating hybrid work arrangements and dealing with this constant change. So kudos to everyone out there who's hanging in there and who's taken the time to join this webinar.
Well, Andrea, since we have you here, mental health, is not such an easy thing to bring up in a work setting. How does that impact the issue?
Yeah, so we see high prevalence of mental illness, and but the issue is that there's a delay in treatment. I think the recent statistic I saw is that it takes on average 8 to 10 years for someone to actually seek treatment from experiencing the onset of symptoms of mental illness. And just imagine if you had a hernia or an odd-shaped mole, you would never wait that long. So stigma is pervasive in society, within our circles and in the workplace. So as you can see here, it's very rare that employees are getting assistance with their mental health and with their addiction needs. Addiction is also something we haven't brought up yet, but that's been another real consequence of this pandemic. We also know that, this delay does incur more costs for organizations because there are a lot of chronic conditions associated with untreated mental health issues like, disability, missed work days, but also we know that there's a correlation of heart disease, stroke, and even diabetes with untreated mental illness. And lastly, I'll say here that, there's a lot that organizations can do to mitigate stigma. I think we'll talk a little bit about that. And it's to your advantage to do so, because when mental health stigma goes down, loyalty and engagement go up. Employees really want to know that they're working for an organization that is being proactive, that is proactively supporting their workforce, and is correlated with better job satisfaction. So a lot we can do running stigma campaigns and continuous education, boosting manager capacity. I think we'll be discussing a lot of that today. But yeah, breaking the silence. And I think what's really key is for leaders to be vulnerable and sharing their own stories, really setting the stage that it's okay to not be okay. And let's talk about it.
Wow, good. Sean, do you have anything you might like to add?
Yeah, I so agree with Andrea. And I think maybe a silver lining of the pandemic has been the attention, the focus, and the conversation around mental health. It's hard to turn on the nightly news and not have a psychiatrist or a therapist talking about the impact, whether it's on workers or children. And I think it's really helped normalize things. At the same time, I think we've seen a lot of well-known celebrities, from the royal family to premier athletes, being really open about their mental health needs. And so I think all of that kind of cultural conversation around mental health creates a perfect moment for employers to really be more progressive and more assertive than they have in making this part of the conversation and empowering managers to talk about it. And stories are so powerful, and stories from people in positions of authority in a company, like Andrea noted, are the biggest thing that we have seen that will drive engagement of Lyra when we're at a company, is whether an executive is willing to share a personal story and advocate people seeking mental health care. The big thing, though, that I would add is I think solving stigma alone is not enough if you're not feeling confident that you have a set of benefits that are going to get employees access and their families to high quality mental health care. So if we take advantage of this moment in time, we run amazing anti-stigma campaigns, we engage managers, there's going to be people in need, and there's going to be a lot more people in need once you open up those conversations that otherwise were going untreated. And if they have to wait months to get an appointment, if they have to go through a lot of work of leaving voicemails and hoping a provider calls them back, or finding a provider that isn't a good fit for them, or practicing treatments that will help them get better, we've done some good in opening up conversation, but don't have a support system in place to actually treat those people. And so in some respects, I almost think access to care is kind of the primary need that an employer should make sure is there. And once you have that, I think it's then really important to invest in fighting stigma, creating conversation, and making people aware that there is help when they need it.
Great. So Lynn, where should HR look to develop a first-line strategies to start tackling this issue? Selecting family-focused benefits for an organization.
I would say on the family-focused front, I think absolutely the first thing to do is to survey your population and get to know them better. Sometimes the people who are speaking the loudest in a room don't always represent the entire group, and so make sure you actually know what the biggest pain points are for your organization. And you may be surprised, for instance, I think like I mentioned, we've seen a lot of kids running through Zoom screens, but we don't think about the fact that people are also taking care of other family members. And I think it's important to survey everybody so you have a good baseline and you know where to start. And then I think you think about, okay, what's absolutely going to have the biggest impact? And is it also the thing that solves for the biggest pain point? And if so, then I think it's pretty obvious that you start investing there. And then I would, once you've identified it, narrow in on the solution. So you may have people coming to you and saying, oh, we need childcare, and then really digging in and understand, what do they need? Do they need backup care for those days that I talked about where the schools are getting closed? Do they need access to in-home daycares in their neighborhood? Do they need backup sitters? Do they need people who can help drive their parents to appointments, things like that? So once you've even figured out what your category is, like, understand that there are many solutions there, and you want to make sure you're finding the right one. And I think, I've mentioned the fact that even though we're not sort of in the heat of COVID like we were 15 months ago, that it's still having an impact. But you do want to make sure that you're balancing this urgency and sort of this acute pain that we're all feeling today with your company's longer term strategy. Does what you're looking at align with your company values? And is this going to have a positive long-term impact on your employees as well? And I think in some cases, it's okay to come in with a short-term solution to get people through this period of time. But I would also challenge people to understand, like, is it really an acute pain, or is this actually more of a chronic issue that people have always been having? And in which case, find a solution that will last your company a little bit longer. And then I would select the right partners, look for recommendations. I think that SHRM is a great organization. You have other colleagues to ask your colleagues if they've looked into benefits. I would talk to your own employees that have worked at other companies to see what they've enjoyed having in the past. And then make sure that you and your partner are absolutely aligned on what success looks like. I think the last thing you want to do is spend a lot of time investing in the research to find a partner just to find out later that their outcome for the program is very different than what you had hoped. And so make sure you're aligned in terms of how you're going to let people know about the program. Is the way the pricing works going to align with what you need to give your employees? If you're offering a stipend, I would make sure that stipend is going to get utilized before you pay for it, things like that. So you just want to make sure that you and your partner, they really understand your company needs, and that both their program, the pricing, and the duration really match up with that. And look, I think this is a time too that it's okay to look for some flexibility in a partner. I think people are willing to do different types of deals right now, as we're still in the pandemic, than they would offer in a more steady state period of time. And then my one final point would be, it's okay to look into some limited, to some differentiated offerings. So one of the things you may find that I think Andrea, you mentioned earlier, sort of like addiction being on the rise. And that's something that may be really a differentiated offering than what you've seen before. But if it's something that is having an impact on your employees, like, I would say, don't be afraid to invest in something that is maybe a little out of the norm of what your competitors or what your colleagues are doing at other companies, if it's something that will have an impact on your employees. So, as much as I say, try to solve the biggest pain point first, it may be that there are these smaller pain points in your organization that are really, really, that really need some help to get people into a better place.
Great. Sean, so returning to the workplace, should we be thinking about this with a process in mind?
I mean, I think absolutely. I think anytime there's a lot of ambiguity around something, having clarity in terms of a process is really important. And so, as employers that we work with think about kind of that process, recognizing that it'll be challenging for people, even people who maybe are requiring come back to the office because they view that as critical to that person doing their job. Recognizing though that can be scary, creating clear outlets and places for people to have those conversations or seek support if they need it, and making that a very proactive part of reaching out and kind of laying out that process for return to work are all things that we've seen employers do and I think be effective as they've had to return some or all of their employees to work. Certainly, giving, as I think has been noted by Andrea and Lynn, given employees flexibility is important if they don't need to do it for their jobs. And, don't need to be there every day for their jobs, perhaps, and creating that kind of flexibility as a broader policy also just gives, I think, employees a sense of control in a period in time where a lot feels out of your control, and is really helping to retaining people and keeping them mentally healthy and productive at work.
Got it. Yeah. Andrea, any additional color on this?
Yeah, I think there's so many great recommendations listed here. And I think one thing I want to call out is on taking the pulse of your employees. I think we've seen a wide range of employers proactively surveying their employees about their needs, their fears, their concerns, what they're interested in engaging with, if there's a wellness program going on. But unfortunately, we've seen a lot of organizations who aren't surveying their people. Survey fatigue exists, and there is always, you have to take it with a grain of salt, as not everyone participates, but we really do, as Sean said, people want to have a little bit of autonomy in their work life when possible, and letting employees weigh in if you're developing workplace wellness programs or stigma reduction campaigns. Get the voice of your customer, let the employees weigh in on what they'd like, and build your programming off of their voice. And again, we mentioned the importance of being vulnerable on behalf of leaders and sharing their story, but there's so much evidence that showing gratitude, having a culture of appreciation is also associated with better retention and higher job satisfaction. Just reminding your people leaders to say thank you, shout outs, to bright spots, things that are going well in a world where they're not going so well. It really can change the employee experience.
Got me in the middle of a drink there. So Andrea, where is our frontline engagement? Is it the managers?
Yeah, this is a really interesting topic, and one that I got introduced to during my role managing Kaiser's employee wellness program. A metric that we follow in our culture of health index is the perception of manager support and leadership role modeling. There is just ample evidence that's been found, and by many organizations, Gallup in particular is one that I really follow, on the key that managers seem to hold with regard to employee engagement in general. As you can see here, they account for up to 70% of variance in employee engagement programs, and just engagement in general, actually. And as we've seen during this pandemic, they really are the ones that set the stage, what the organizational mission and values are, and they're key in helping employees navigate stressors, setting clear expectations, helping manage workloads. But also they're in a key position to, encourage employees to take time off, to understand the symptoms of stress and burnout. And ultimately, when they can successfully help their team feel supported, they really are in a position to reverse and or prevent burnout from happening.
Yeah.
I would add in, Mike, that when Urban Sitter's corporate benefit is when our materials for onboarding are shared at a meeting with all the managers, and managers are made aware of the benefit, our utilization is much higher and our satisfaction amongst employees is much higher. And I totally agree, Andrea. I think they have the pulse on the employees, and it's oftentimes you're in a crisis situation when you need any of our services. And so it's usually your manager you turn to in that situation. So I think the more that managers are armed and also involved in the decision-making around company culture and benefits, the more likely it is it'll both be utilized and it will have a positive impact on your company.
Yeah. Andrew,
Yeah.
yeah.
They're true gatekeepers to information. So much stuff is just being sent out via email these days, but really they're in a position to help information come alive, reminding employees about wellness opportunities that exist or that they have an EAP or, these other mental health vendors like Lyra Health. And as you can see here, really interesting statistics that shows that the well-being of managers directly impacts the well-being of their team. There's a social contagion with regard to health and wellness. And so they really are a kind of more high leverage population to intervene in the workplace. So really, we want to make sure that managers are trained to recognize the signs of stress and burnout and mental health. By no means should they feel pressured to be diagnosing people, but really just understanding, what does burnout look like? As we mentioned, it's chronic. There's 3 characteristics defined by the World Health Organization versus, symptoms of anxiety and depression. And really, that's an opportunity for them to present wellness information that's available. They should be experts in what employee wellness resources exist. Of any employee, they need to know exactly what's available through the different health plans and vendors. And really, as we mentioned, stigma, there is stigmatizing language around mental health. And so training them on the best ways to engage employees in a non-stigmatizing way, and really just upskilling them on how to have empathetic, compassionate conversations. And the ultimate thing is just checking in frequently. I think there's a direct correlation to employees who feel supported with the frequency that they check in with their managers. So having some parameters around what's the recommended amount of times that managers check in with their teams each week or each month. And really just, making sure they're casually asking, what support do you need? How can I help you? Really being, person-centric and helping employees and creating that culture of care and culture of support.
Great. Sean, is there anything you might add to this?
That was pretty comprehensive. So at the risk of being repetitive, I'll just say that I agree with everything that was shared.
Okay, great. So remembering managers suffer too. I guess we don't want to, assume that they're all okay. They're going to have their own issues as well. So there's some issues around this. I don't know, Andrea, do you want to just touch on this real quick? No.
Yeah. Just as the statistics show here that, again, as these are being a key population to intervene in, they do have higher rates of stress and burnout. They need support as well. It's a lot to ask to, hey, in addition to all of your tasks and managing your team and getting goals achieved, you also have to be checking in on the mental health of your team and having compassionate conversations. It's a lot to add to their list. So really creating a forum, making sure that they feel supported. What do they need? It's really going to pay off, I think, in the long term for organizations who make that effort.
Okay. Well, let's shift a little bit here to now psychological safety. This is a term that just kind of was brought to my attention really in the creation of this presentation with you guys. Andrea, why don't you kick us off and talk a little bit about psychological safety, and then we'll ask Sean to step in on that as well.
Yeah, psychological safety, the concept has been around since the 90s, but it has become more prevalent, I'd say, in the past 5 years, led by researchers like Amy Edmondson of Harvard University. I really like this image on the right-hand side. It actually comes from a study done at Google, a 2-year study where they were trying to discover what are the elements of the highest performing teams. Is it demographic? Is it IQ? They really weren't sure what it was. And oddly enough, these 5 indicators are what the highest performing teams shared, with psychological safety being the number 1 characteristic. So psychological safety really fits in with your mental health burnout mitigation plan, because it really creates an environment where people feel supported, feel safe to bring up their challenges. Obviously, in a team setting, it helps, make sure that we're bringing all concerns on the table when we're creatively finding solutions. There's also a correlation that teams that have more psychological safety are more willing to accept diversity of opinion. So there's a direct correlation to your DEI initiative, which is also really trending for important reasons in the employee wellness world. And as you can see here, you know, there's direct correlations to business outcomes that really I think everyone is looking at, you know. So it's an interesting term. There's a lot of research out there, things we can leverage. I think the next slide has some tips, but a really interesting concept that I think is under discussed in the wellness world.
Yeah. And Sean, is this an area that you guys are focused on looking at as well at Lyra?
It is, I think, because it's part of that conversation around stigma and making it comfortable for people to seek help. And so I think one of the things, and Andrea said this before, and I'll just reiterate it, is the importance of having managers and executives and leaders speak out about mental health needs and just be vulnerable in their positions creates a lot of psychological safety to know that people can struggle at all levels of the organization, that it's okay to talk about that you can talk to your manager about it, and here's how. I think is a really powerful thing, and getting people to feel like they're part of an organization, to have trust, and to seek help when they need it. And so a big part of our work with our employer partners and doing things that we call like our notice and respond trainings and others is teaching managers, and I think Andrea may have mentioned this before earlier, not expecting them to be a therapist or a clinician and being able to diagnose or triage somebody, but rather how to create a space where people can feel safe so that they can share their struggles, and then have some aptitude to be able to recognize when somebody's struggling and have the right language on how to connect them to services that might help them.
Great. But folks also too, I see some questions coming through. So yeah, if you got questions, we're responding live on the chat. So please send your questions our way. Well, let's look at moving on into things that we can do to foster team psychological safety. Andrea.
Yeah, so just a few tips here. You know, I mentioned the power of appreciation. Quite honestly, building psychological safety can be as easy as saying thank you. There's a correlation between high psychological safety in individuals and those who have been recognized in the last month. So really taking efforts to build a culture of appreciation, maybe embedding things in your workforce where people can send thank you cards, or you have a moment of gratitude at the beginning or an end of the meeting. And really, you know, psychological safety isn't about being nice or making people feel, safe. Really, it's about encouraging candid, open, and authentic conversation. You know, we want to see some positive friction every once in a while. There's been a lot of interesting content created recently on toxic positivity, and you know that can really ruin a company's culture. So it's not about just focusing on the good. We really want to have honest dialogue, and that can be facilitated through role modeling, having leaders and managers acknowledge their faults, and that's okay. You know, we learn from our mistakes, and really incorporating that into your ethos as an organization, and really being curious, asking questions. That is, again, the association with the inclusivity that we want to see. Why many people of, color have said that working remote has been better, because you're acknowledged more equally when you're able to chat something in. And so how can we incorporate more inclusivity into our conversations? It also correlates to higher psychological safety scores as well.
Lynn, do you have anything you want to mention or chat, add on psychological safety?
Yeah, I mean, the one thing, and this is kind of bringing a different perspective, but one of the things that we try to spend a decent amount of time on is actually the psychological safety of the care providers that we work with. So you can imagine that, I think it's great when companies are focused on this. You can imagine in many situations, care providers, the people who are doing the day-to-day taking care of, whether it's kids, so whether it's a nanny or somebody who's taking care of an elder person, psychological safety for them is often overlooked. And we've tried to put together materials for the families that use our platform to make them essentially better managers of their care providers. Because you can imagine I was thinking, Andrea, about your previous slide, and I want to try to do something with that graph, because I think oftentimes when you're working with an individual who's providing care, you don't think of them as your employee the same way that you might your colleague at work. And they have needs as well and need to feel safe in their jobs. And it's an area that's often overlooked. And even just hearing you talk about it, Andrea, made me excited to try to do more about it on the care provider side.
Great, good. Well, kind of getting down here to the short straws on some solutions. So let's move into creative employer solutions. And I'm going to ask each of you to, I've thrown some stuff up there. Maybe you might want to comment on some of these, or there's some things not up here that you can add. But why don't we start with Sean on this one and move from there.
Yeah. So I think we've seen companies actually create mental health specific focused ERGs. And so I just think that has been a really innovative way to create dialogue, to create some psychological safety when there's employees who are really speaking publicly about their experiences, either for themselves or their families with mental health needs. And it also creates this amazing group of people that other employees at the company can reach out to for guidance and support. And so I think kind of the rise of mental health ERGs has been really, really important. I noted before too that we've also just seen employers do more workshops or trainings or presentations. We've even had employers that have done like an employee conference on mental health, tying that to Mental Health Awareness Month or World Mental Health Day in October. So that's coming up. So it could be a good idea for some employers. And really thinking about, enhancing mental health benefits, and that can range from tools for stress and resiliency to feeling confident that there's access to higher level support are a number of the things that we've seen employers do. And as employers have been communicating across all these things, I think we've also just seen employers using a lot more creative tools and how they communicate about their benefits. And so that goes to recorded executive stories, that goes to using short videos that normalize mental health. And also a lot more employers starting to rely on text to promote benefits to employees. And wow, we've seen when a text goes out about a mental health benefit, the enrollment and registration at Lyra at least has been off the charts. So it's proven to be a helpful communication tool to kind of meet people where they're at and where they live.
Wow, that's interesting. Andrea, anything on this?
Yeah, I think everything Sean touched on is so key. And yeah, I agree with the power of text. We incorporated that before I left my role in TPMG for this current role. And yeah, very effective strategy. So yeah, I agree. Employee resource groups, another way that we at Kaiser support our customers in workforce health is helping start wellness committees. So we have a toolkit on our website for groups who are interested. We have many groups that have wellness ambassadors or wellness champions. So again, we want the support from the top, the support and role modeling from the top, but we also want, from the ground up. We really are more likely to listen sometimes to people who look and sound like us. So having kind of both spectrums of engagement is really important. But yeah, I think this is a really great comprehensive list here.
Good. Lynn, we have it all?
I think you've hit it all. I won't add any more in because I think we've got quite a great list here, but just like a +1 to all of these, I think if your company is starting to implement any of these, you're heading in the right direction.
Great. So then how about maybe some concrete examples or best practices of what an organization can do to create a culture of care? And this is our final slide. So I'll ask each of you to offer anything you might like to add on this, and then we can wrap it up. And please, again, send us your chat questions through the chat box, and we'll be happy to respond to those. But Lynn, you want to kind of kick this one off?
Sure, I'll kick it off. I mean, to give a very concrete example, I think one of the things I'm most excited about for the caregiving benefits that happened during the pandemic is that a lot of companies realized we used to have clients come to us and say, okay, we're headquartered in New York. And if you can support our other offices, great, but otherwise don't worry. We've now seen the flip happen where people are saying, hey, we have a distributed workforce, some in manufacturing facilities, some in headquarters offices, and we need to have a benefit that's equal for all. And in the case of caregiving, oftentimes the structures that provide care look very different in more rural areas versus urban areas. And so We did a really exciting pilot with a CPG company where they had some very remote employees. And we said, hey, listen, in those areas, sure, we can go and get care providers to make them accessible to your employees. But really what your employees want, they want to be able to use the care provider next door or the family member who takes care of their child. And they want to use your subsidy to actually recognize that person. And they said, you know what? Absolutely. And by allowing those care providers to come onto our platform, we managed all of the subsidy payments and we made sure that the people were vetted. But I guess it's just a great example of, I love that example because it's both meeting your employees where they're at, and it also recognizes a lot of the unseen workforce that helps to support some of these systems. So I'm excited that, when you put the slide up here, like people are coming up with more creative solutions now, and I hope that some of those will stick.
Yeah. Andrea, anything you'd like to add?
Yeah. I can share a personal example here at Kaiser Permanente and my small umbrella marketing, sales, and oh goodness, what's the acronym? MSSA, Service and Administration. We've had kind of an informal policy on trying not to have meetings after 12 or 2 p.m. on Fridays and keeping meetings short. But since the pandemic, that has more or less been formalized and official documents have been sent out. So I think that, that's a really great example on how Kaiser is supporting me and my team on work-life balance, really encouraging meetings to be 45 minutes rather than an hour, 20 minutes rather than 30, especially in this virtual world where we're back to back, giving people a little bit of a buffer to take care of their personal health, or just take the opportunity to look into the distance as we're staring into the screens all day. And some other concrete examples, really, I would guide everyone to go to Kaiser's corporate health website, where we have amazing tools for our customers. We have updated diversity, equity, and inclusion toolkit resources, sample policies for healthy meeting guidelines, and related to the manager training and teaching managers how to kind of screen for distress, I'd say. We have a new mental health training toolkit that's posted on our website, something that Kaiser has launched internally for the past 4 years. It's a 30-minute interactive online module that can be turned into a 2-hour in-service through our facilitator's guide that describes that. So I recommend everyone heading over to our website. We also have a psychologically healthy workplace checklist that you can take to really just do some baseline measures as you progress.
Great, thanks. And Sean, like to add anything, and we can wrap this up? Yeah.
No, I don't think I have anything that new to add. I think we covered a lot of good stuff today, and how employers can really be more proactive about creating a culture of mental health and caregiving that I think will affect things like burnout and other things. And so I think at its core, it's like, get going, start the conversation, start having dialogue at a senior level about how we can be more vulnerable and share our own experiences, and create that space for employees to seek help, and then think about what kind of experience you want to have when people do reach out.
Great. Thank you. Thanks. Well, I've really enjoyed having you all here. Thank you for participating and agreeing to step up and share with your knowledge and your experience with the folks that have joined us today. We are all here to help you. Our emails are there if you need them. This presentation is available to download in a PDF format with this information. There's a live link in there as well from Lyra Health on a report. Also, Johnson & Dugan does have a booth through this virtual conference, and in that booth, I will also have some additional materials, some of which Andrea mentioned, that you can come to and download from our booth. They'll be up and ready to go for you when you need them. And with that, we wrap it up, and thank you for taking the time and caring about your workforce enough to join us for this presentation. And we hope you all have a good balance of the 2021 year and a mentally healthy one. And you all see the needle move a little bit here in your organizations with regards to your access to mental health you're providing your employees. Thank you very much. Thanks, guys. I appreciate you joining me. Take care. Bye-bye.
Thank you so much for attending our session. And be sure to take the survey located at the bottom of this session. We want to hear from you, SHRM family.